Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So our topic today is cleft care in adopted Chinese patients, challenges and strategies. My guest is Dr. Jiang. Dr. Jiang is director of the Frederick J. McCoy Cleft and Craniofacial Clinic and the vice chair of the Department of Surgery at Children's Mercy, Kansas City. Dr. Jiang, welcome to the show.
Thank you very much. Thanks for having me.
Why don't we start with you telling us a little bit about the Cleft Lip Palate International Adoption Program?
So we have at Children's Mercy one of the oldest comprehensive multidisciplinary cleft teams in the Midwest. It was started by Dr. Frederick J. McCoy, and it has been continued for the last past several decades. This clinic takes care of children with cleft lip and palate differences, and large portion of the kids that are being adopted from China have cleft lip and palate differences that are either not addressed when they're in China or partially addressed. So when they come over to this country, then additional care is needed, and we see those kids on a regular basis for the last 20 years or so. So it is in collaboration with our international adoption program at Children's Mercy, along with the staff and the team members of the cleft team, that we are able to coordinate a comprehensive cleft care for these internationally adopted children, with the particular focus. The large portion of these patients are coming from China and other Asian countries. So we have a large population of these patients that we take care on a regular basis.
So how is Children's Mercy and your team uniquely equipped to provide this service?
Well, to take care of a kiddo with a cleft lip and palate difference really requires a village, a whole comprehensive multidisciplinary team that includes not only plastic surgery, but also ENT, dental, social work, nutrition, occupational therapy, speech therapy, hearing. It's a whole slew of patients, a whole slew of staff members that are going to be participating actively in the care of these patients. So in that regard, then, we have one of the oldest team in the Midwest and one of the largest team in the Midwest, because we have 4 full-time pediatric plastic surgeons that have dedicated our careers in taking care of children with cleft lip and palate and craniofacial differences. In addition to that, I think we're uniquely equipped to deal with adoptive population, mainly because our international adoption clinic is so strong. They see kids after they're being adopted and make sure that they're medically fit to undergo the treatment that they may need to undergo. And they also see the parents before and do pre-adoption consultations to make sure that the parents understand the complexity and the degree of involvement of the medical care of these kids that are coming over.
I saw a presentation that you did some time back, and you presented some information, some data on the number of cases of cleft lip abnormalities in certain regions of China, and it was quite impressive, some of the numbers. Why is that the case? Why are there so many of these abnormalities in certain regions of China?
Well, it's interesting because the population incidence of cleft lip and palate in general all over the world is about 1 in 500 live births to 1 in 750 live births. That risk is particularly increased in China to about 1 in 250. So genetically speaking, folks of Asian descent have higher incidence of cleft. And that is something that our genetic counselors are well versed in addressing and dealing with. And so genetically speaking, the Asian population, particularly Chinese population, are more prone to have cleft lip and palate differences.
And so, what are some of the initial exams that a patient may go through when they come to your clinic? What are some of the initial exams that are typically recommended?
Oh, okay. So actually, the initial examination begins with just examining the records. So even before the parents go over, we have the ability to look at the adoption documentations and the description of medical procedures and conditions that are contained within the adoption report to give the parents a basic understanding of what's going to happen once their child gets here. And when they're over there, if they should encounter any difficulties, particularly with cleft lip and palate kids that are being adopted, the number one complaint is feeding difficulty. We're able to counsel them via telemedicine or call or email to sort of help them through that initial phase. And then once they get here, they are evaluated by our International Adoption Clinic first, get all their vaccinations and titers and lab works drawn, and then we see them 2 to 3 weeks after they have been seen by our International Adoption Clinic to start the assessment of their cleft lip and palate difference. In that examination, we examine the kid. We delineate what surgery they had and what surgery they may need, and we talk to the parents about the preoperative care, the postoperative care, and the expected outcome of surgery. And then our nutritionist, our occupational therapist will help us get the kids feeding in the correct manner and get the caloric intake increased to where their malnutrition is starting to resolve and things like that. So that's the initial consultation. It begins with even before they go over to other parts of the world
Right.
to pick up their kiddo.
And how many children and families have benefited from the program?
Oh, quite a bit. So, starting in the late 1990s and early 2000s, we saw a gradual increase in the number of kids that we're treating here. On average, we see somewhere between 20 to 30 adoptive families a year now. So it's actually quite a bit.
Yeah, and so what are some of the considerations for primary care physicians or even parents, considering the best referral for a newly adopted child with cleft lip or palate? What are some of the things they need to think about in the workup?
I think the things to think about is to focus less on the cleft lip and palate difference and more on the whole well-being of the child. As a surgeon, we obviously want to operate, but we can't operate on a kid that is malnourished, that has other concomitant medical conditions that may prevent us from doing a successful surgery. So we want the parents to not focus on the cleft lip and palate difference. We want the parents to focus on the overall well-being of the child. The cleft lip and palate will be taken care of in a timely and expertly manner once everything else is settled. And that is the same message for the primary care physician as well.
Right. Very good message. Where can people go for more information?
They could go to our Children's Mercy website, and under services, there will be the Cleft Lip and Palate Craniofacial Clinic tab, and they could look for our contact information there.
Very good. Dr. Jiang, thank you for the work that you're doing, and thanks for coming on the show. You're listening to Transformational Pediatrics at Children's Mercy, Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Michael Smith. Thanks for listening.